Hampay na. Hampay lang, ano? Ganda mabaka sa bigas, ano? O tumangkin, bagay ko.
Then comes this was the first time when it was in October 2020 that compassion rate of use of tablets were in pregnant women received reported a 19 disease. And this was the data on this, and what were the number of patients? Very, very small, like 86. And now there is a more number, but still this is not to be used very easily, but it has to be used when it's indicated and it will be used. The third one comes, tocilizumab. It's a monoclonal antibody. And what is its main thing? Because we think it's a helpful in the patients or who have cytokine storm. But I really want to warn everybody, it's to be given again very carefully, because you need to make sure this patient doesn't have any infection and superadding infection. You need to make sure she doesn't have gallstone normal, there's a CRP which is not very high. Even though both of these inflammatory markers are increased because of any infection, whether it's viral or whether it's bacterial, but we need to be careful with this bacterial infection because it can push them into sepsis and shock. So again, if it is to be used, it has to be used carefully and after hepatitis. The next question comes about, this is about, it doesn't appear that tocilizumab has detrimental effects for the mother and newborn, but close monitoring of infection should be considered, especially if the mother is not immunosuppressed. What about mainstay of the treatment, which is the oxygen saturation? And we have to aim that we keep the oxygen saturation above 90. And also, it's very, very important not to allow it to be less than 90% for maintenance oxygenation. And in pregnant women, we have to aim that it's more than 95%. Why? Because we have a baby hormone. So what are the different ways of giving the oxygen? I think this is the first time when I have used so much of oxygen in my lifetime to see that it's getting used. First of all, if you need low concentration of oxygen, you can use is a cannula. And how much you can be used in this cannula for a general information, you can go up to 6 liters. The advantage is patient can eat and drink and they can be comfortable with it. But if you require a little bit more oxygen, then you have to go to the face mask. We all know you can go up to 10 liters, maybe max up to 1 liter, 12 liters. And again, how much oxygen it supplies, it's about 60% of the oxygen. And it's uncomfortable, they have to remove it and they cannot remove the moment they remove the oxygen, they start getting flatulence and they become flatulent. And the biggest achievement which was being experienced was use of high-fluoride cannula therapy. And what is the advantage of this? We are using it, but we have a respiratory therapist who has been fixing and setting it up. You are delivering an agent, first of all, oxygen, which is 37%. You are verifying it to 100% relative humidity, and also the oxygen concentration you can go up to 60 liters per minute, and it was unknown for an observation for me that you can go up to 60 liters to oxygen with these high oxygen. The second most important element in them is they are very potent compounds. Because if you look into D dimers, the D dimers in these patients are in pregnancy are anyway very high. But if you get a D dimer that's quite high, you have to be does this patient have associated thrombosis. So to prevent all this, you have to, even though they are asymptomatic, you have to tell them to mobilize to high grade and then and one of the ways we give is we use all local molecular and the prophylactic dose. And we have used hypergalactic or therapeutic doses where required depending upon the patient's history and severity of the disease. There are now studies saying that you don't need to go to intermediate dose of low molecular therapy, prophylactic therapy. So prophylaxis is supported by almost all big bodies like Oil College for anticoagulation, International Society of Thrombosis and Hemostasis, Chest calling them just physicians and people. Everyone supports use of vaccines in COVID. The ignored stuff is in this era. We know we are leaving them alone in the there's nobody around them and there's no one to talk to them. And there has been one now studies which are being published that COVID-19 increases in depression rates, anxiety rates, post-traumatic stress disorders, and not only during pregnancy but even after. So it's a big concern from the which is very ignored even in any part of the world, and a lot of focus needs to be on these patients when they get pregnant. This was a publication which came from Australia. This was the experience of receiving and providing.
Kumukulo na.
Yeah.
And what was there? So let's see what was the patient's
Naikat na yung live ko tapos nga mo noon. Ay, live in video.
anxious,
Nag-stop.
Malahan na makalive tayo.
Hanga video.
Ha?
Video lang hanga live. One. Mati nga nag-stop.
Isolated, safe, professional, uncertainties, restricting information. Then what was the requirements? Indeed, the same uncertainty, anxious, challenging, stressful, frustrating, and difficult. And what did doctors say? Confusing, uncertain, distance, anxiety, challenges, distant different, again, distant management, different and anxious, and worried about the safety. So all of them had one thing that they said they were very anxious, stressful, and uncertain what's going to happen. Now, if I go to the normal, there's no role of doing straight away cesarean section in phase 1. So they can deliver the child except the patients who are on a high cap because they're so breathless, their spirit rate can be depending on how sick they are. So yes, you have to do the cesarean section either just to, I didn't put it here, but one of the things we noted, the pathological CTGs are in this group of the patients are carrying very hard. What's the reason? There are some studies now showing there is something called COVID placentitis, so there are placental changes and which are making the babies to get infected. And even the stillbirth rate, we had 0 stillbirth in the first week, but in last week, the Delta week, we had 7 stillbirths, 6 stillbirths who came from home with the stillbirth, and only 100 in the hospital, but there is an increase of stillbirth. And what did we know? There's also something called COVID-associated coagulopathy, that these patients are very high risk for developing coagulopathy. What about breastfeeding? There is no harm, and there's no need to separate the baby from the mother. The only thing that you advise the mother is to wear a mask. And breastfeeding is absolutely safe, and there is no increased risk of being infection. What has been noted, it has been noted recently to study that if you take the cord blood samples of the mothers who had COVID infection, and there are antibodies in the cord blood samples exposed to neutralizing antibodies and spike. So quite a good that makes vaccine. Now let me go a little bit about the COVID vaccine and pregnancy and breastfeeding. What are the main things? The key message came from the RCU was that all this was from the Committee on Vaccination and Immunization. What did they say? The COVID-19 vaccine should be offered to pregnant at the same time as the rest of the population. It just happens now, because there are so many uncertainties. The mothers are losing, they are worried about their babies. So again, this is a very difficult time. So again, you have to stress on them not to stop the breastfeeding. They can get vaccinated and they can continue to get breastfeeding. There is no need to avoid pregnancy after vaccination, and there is no evidence to suggest that COVID-19 causes fertility issues. So this was one of the issues that COVID-19 causes fertility issues along with pregnancy now, and for males the same issues. So eligibility for vaccine during the last report which came on August is that it is strongly recommended. The word strongly has been introduced. You can use Pfizer or you can use Moderna. There is a results available, more than 2,000 women, no harm identified. There are no adverse minor side effects like that, which is for everyone. That is the soreness at the side, headache, and fatigue. Yes, there are some rare reports of having facial palsies and other things, but they are very, very few. Antibody bodies have been identified, those who received the COVID vaccine, the blood, in the cord blood
Masangit.
as best, which is going to be beneficial for the baby. Can be
Gamindot
given
buting nga
any
dyan
time
pagkatangit.
during
Isublik no
pregnancy.
haan.
We still are not giving in the first trimester, but can be
Sublik
given any
atin na
time
ano.
during pregnancy. And why we need to support every mother to give them vaccination. There's one simple thing. That's those who got admitted to hospital and developed severe infection. 98% of them had not received any vaccine. So again, a very, very strong message that vaccination prevents the severe disease. So these are my take-home messages. It needs a multidisciplinary care. You need to stratify the patients. You need to start them on oxygen therapy. You need to give prophylaxis to all these patients. Use dexamethasone, but if you want more than that, you have to use antiviral like Navisprin, or you have to use tocilizumab. You need a multidisciplinary care, and vaccination is very strongly recommended. And we have to think of nothing. At all times, we have to think is pregnant transmission. And there's no difference to contract the disease. Whether it's anybody, whether pregnant or non-pregnant, each of them can contract the disease. But what is the most important? 2/3 have no symptoms, but risk of severe disease is especially in the third trimester. And the Delta variant has been a disaster because it gives more severe disease, and also the ICU admissions are increased due to Delta variant. And it also has been noted that double the risk of stillbirth and 2 to 3-fold higher risk of preterm birth in these patients. So now, what is the best is to vaccinate all these mothers, and we really need to learn, because our patients no longer see our faces, they see our answers. People say we are learning to smile with our eyes. And telehealth and patient monitoring are prime examples of unconventional treatment modalities and new ways for providing care during the pandemic. I want to stop here and say that please keep your basic 4 things, that is social distancing, wearing a mask, and hygiene, and take care of your patients. And I think what's most important element is we have a team which was dedicated just to see the COVID patients. And I want to stop here to say thank you, and I'm going to down questions.
Thank you, Dr. Wani, for such a comprehensive talk with a very important topic that we will continue to discuss and debate now and in the future. I can see many questions here. I'm going to try to choose only few, and maybe later on Dr. Wani can answer the rest. In the pregnant woman, a pregnant mother, if the pregnant mother is positive, does COVID-19 could affect the development of the baby inside the uterus?
I said it doesn't cause, but what is important now, be worried about the Delta variant. It causes, in some cases where there is moderate to severe disease, it can lead to placentitis, COVID placentitis, and can lead to stillbirth, but it doesn't get transmitted as such to the baby. That's it.
Question from Dr. Safia Maraj. Does it increase the likelihood of miscarriage infection with COVID-19?
Miscarriage rates have not been found
Oh,
to
come on,
increase in the correlation with the COVID, but yes, we don't have
Oh,
any
come
data
on.
to show, but there's no evidence so far that it increases the risk of miscarriage. The answer is no.
The same thing, there's a question from Dr. Malin. Any theory why the stillbirths increased in the second wave?
I did say it is a Delta wave which affects the placenta, leads to COVID placentitis. I have beautiful histological pictures of COVID placentitis, but I think, the time is so small, so limited, I cannot put those pictures. Yes, it does affect the placenta, and that's called COVID placentitis. If anybody sees the placenta, that's pretty, lying as if you are touching a sandpaper.
Okay. Few questions about the vaccine in pregnancy, what trimester. So I'll bring them all together. I think 4 or 5 of these questions. If you give a statement regarding the safety of COVID-19 vaccination during pregnancy and in lactating.
Natangkit na yan.
Yes. I would just say, if you have to give anything better to a mother during pregnancy vaccine,
Abay, uray masikog kumabaling
I
vaccine.
have seen what COVID does for the
What?
pregnant.
Kung nada pwede
So
naman.
I really would strongly recommend, and there's a lot of evidence that it doesn't cause any harm, that it rather increases the immune status of her, and also she transmits the antibodies to her baby, which is also protected. So if it is anything which is coming from ECOG, International Medicine Society, WHO, Royal College of Midwives and Royal College of Obstetrician Gynecologists have very strong recommendation to vaccinate. Now, if you go to the world literature, there is no time frame when you should vaccinate, but here in Abu Dhabi, we are vaccinating them after first trimester. I would say just fine. Because people always think it causes congenital abnormality. There's no report of congenital. And if they take the vaccine and they want to plan the pregnancy, they can go ahead and plan the pregnancy. And anybody who wants a vaccine soon after delivery, please vaccinate them. It doesn't cause any problem in the breastfeeding. And it can give immunity to the baby. And very quickly, within 3 weeks, they have an immunity. Rather within a week after the second dose, the status can be improved. Yes.
One last question, which might create lots of debate. Could COVID-19 cause a sexual transmitted disease?
Well, it doesn't. No. It doesn't cause anything. It has nothing to do with sexual transmitted diseases.
Well, I would add if it is symptomatic, I'm not sure anybody would be
Manjit.
able to.
Oh, tambay dito yun. Bus. Anong oras ka na alis atin? Anong oras na ba? Ha?
Busog ka, mamaya hikain ka.
Ha?
Mamaya hikain ka.
Bakit?
Hindi na
Hindi namang matagal. Nung bus. Nung bus yan. Sa Panagoria. Dati ba na may bakod dito sa gitna ating or wala? Parang, ay meron na ba yun?
marami na
Hmm. One zero. Ang lamig sa kwarto natin kaya lumabas ako kanina dito sa kusina.
Sinabi mo ba ako na nakatalong mo?
Oo, kaya sweater ako kanina lumabas. Doon na lang ako sa kusina, saan ko tumambay. Ang lamig. Hindi na bang ano yan?
Ha?
Hindi ba na nakokontrol?
Dito ang controller sa kabila.
Kaya nga.
Yung kanila.
Kas nakikita pa dito sa ano? Nakakamiss din na mamasyal ngayon. Kaso nga walang mainit pa maggala-gala. Andun sa baba. Kaya dito na lang. Konti ng tubig. Sabaw, oo. Dagdagan mo.
Water pa more. Nangot ka na kunan ni madam. Wala na kay tita tita bito. Handa na talaga.
One. Apa yung takagora da?
Madam, ayaw niya ng patis talaga sabi ng mga patisite.
Alin?
Ayaw nila.
Ah, basta sila oo sa patis. Ayaw nila. Isa atin. Kasi si ano nun dati, ayaw niya yung katukayo niya.
Sino? Ako kahit ako. Pero masarap din pampalasa.
Lalo yung ano.
What I mean is, sa inyo siguro walang nagpapatis masyado sa inyo, no? Wala sa sa amin lang sa norte lang siya patis. Pangasinan. Diba?
Kasi
Naglalagay din kami pero isa, 2 kutsara.
Ah, ganun.
sila iba yung bagoong nila.
Yung
Yung
bibira.
lamang.
Kasi alam mo itong ang patis, yan yung nasa top ng ano. Parang bagoong yung ano nun.
Hindi ka bibira or gumamit patis.
As I say, we discussed with the Prime Minister that
Sana makadala ulit ako.
Alin?
Hindi pa nga nakapag-partay. Makadala ako.
Nakadala na.
Makauwi.
and they also understand that there should be solutions, immediate solutions. Solutions for the short term and also long-term solutions.
Lalo na pag may catering. Oh my God.
Maraming ano.
Kasi kinabukasan hindi na nila yung kakainin.
Sayang din. Pero sa huli yun, siyempre sa last yun.
Hindi yung mga amo hindi sila nakukuha, yung mga katulong lang din siguro din no.
May mga madam na nagpapatag away sa mga kaibigan niya. Pero may madam din ayaw nila.
Oo, kasi ano,
Tapos yung last na dinala ko dito dong, pinangbabalot ng katulong. Pero meron silang nilagay sa labas. Kukunin daw yun ng mga nagwawalis.
Parang bibigyan.
may sa mga ano,
Nag-cleaner sa mga sa daan-daan.
dukkan sabi nila.
Saying the reality bold
Parang may cooler sila doon sa labas eh.
Doon nga lang, mga food na.
Sabi niya, naku, pag Ramadan kayo araw-araw, nanawa yan dyan, kakabalik-balik yung mga ano.
Mga tao, alam na nila kung saan kukuhanin.
Lebanon should own the process, should own the leadership.
Ganun ako dati sa pinag-part-time ko sa Dubai dati. Lahat ng mga, yung mga ganyan, may cooler din talaga na lalagyan. Alam na nila kung saan kukunin.
Yun sila laki na to. Thermo king yung sakyan. Malaki.
May color yan. Hindi kasi pwedeng mag-moist ang pagkain. Kasi di ba sa may catering, may limit lang yan eh. Darating yan ng alas 8. Kailangan alas 10 kakain sila. Kasi may ano yan, may temperature. Tapos meron yan sila na pampainit doon sa ilalim. Pag nag-ubos na yun, start na sila kakain. Kasi syempre kwento-kwentuhan mo na yan, chismis-chismisan, pagpapayabangan ng mga alahas.
Pero hindi sila din mahilig sa mga mga gold, yung mga fashion lang din.
Bumaba daw ang gold na naman ngayon. Nakita ko sa news. Pero 2% lang.
Maganda po sa
What I mean is medyo bumaba siya.
Gusto nga ko nga din pumunta din sa
Pag-invest kayo ng 21K. Kasi ang agency mababa. Kunti lang binawas eh. Pero dito mababa. Dito ang sarap.
ganyan din kahaba na yung buhok natin ngayon.
Pinasyagi ko.
Sabi ko nga, ipasyagi mo na yung buhok mo. Pero mas maiksi sana kasi ano. Sabi ko sa kanya, kasi i-split naman yung buhok mo.
And she was discharged to St. Peter's Hospital, where she special baby unit on day 15 to be near. So, what about chronic renal disease and pregnancy? So, you need to do preconception counseling, because it's really quite important to become
Nga bakit? 30 minutes pa kasi siguro.
Ikaw mo.
classification of mind, moderate, and severe disease.
Tingnan, marapay. Natangkin dati to.
In general,
Pinaano
we
lang
normally
ako.
say if the level is below 125, that is considered mild impaired renal function. 125 to 150 is considered moderate renal insufficiency, and above 250 is considered severe.
Ano man mag-yes kayo?
That is really quite important because that will help you categorize.
Ito na yung
Of course,
i-integrate
this is
din.
just the guidance because patient size will indicate whether these levels are
So,
exactly
dati tao.
Mano ti ko ada di ticket da?
So what we normally do is
County medical.
so we normally give them advice about fertility as well as
Doon yung pakikita yung group nga ko pati ticket.
about the risk of
Kaso,
preterm delivery.
kung napangkamimot namin idin. Kahit ko pa nandiyan ko hanapanan.
Worship na panak dyan.
Ano,
Dias Water World.
nag-slide kami kinakinila dyan na.
Nag-slide kayo?
As lang na naawan diti amos mga pagbiit. Di nagkasititingot ko di chay nga hanggang ako tanong ko akat bakti pag ko baka madidi di slide ko kat maipuruwa ka din ako nagbiit.
Saglitan na ano?
One, radyo ka lang pagbawang ko. Ko na.
Andiyan ka diante, sumakay ka diante, tube.
Napang kami dinato.
Tapos,
Ay natin nga will natat nagbut. Sikayin ko na siya ko na natin nina. Pero sakit kita kan ko mabuto nga. Pero ko nakit, oh, ito nga kinadon mo ay ditiyas, no kumata talaga nga
dala din lang.
sa baliti pa kay purwakan na wala niya do ko man na ang accident din ko nak di ba? Kasi inisip ko posible wat kat no isa tigasat mo nga talaga di isa ko na. Tinagas ko mo tayo na kasi lang nagpatay tital ko ta na din kailangan straight ka lang hanggang baba. Kuna na din.
Ada instruction, di ba ganang kasta?
Ada gibag pala kasi niya. Hindi abot nga kasi nga ron sa ka. Ikaw to pa diyo na makasta. Tapos nga ikat no go kan nga ikat bumabakan ay na pagbitsi ka. Pagbit nga dapat. Wah, kapag kasi mo lang kada di ka baba, nagpaspas. Umarik ng kasi diba ano. Pwede may isang babae nga kabayan kat nakapag-picture pa ay agad ibasik nga kamera na nga di waterproof. Ida rejente ko ang rejente tingnan kasi ito nagpicture ko nga nagtas din o nagturod man ko na. Ay, mabuti nga ko na Ate Wilma. Nagsupli.
Diyan na pwede yan yung phone ko ako.
Ah,
Dati ang mga kasi phone ko nga yung Samsung ND11. Wala na nga waterproof. Mga damit. Di ino sa ko. Siyempre, so nag-picture kami ng husband. Tapos, anak nag-call YouTube ta mabuti nga kayo. Yung kasakit at dati ko ngayon. Di upat kayo. 1, 2, 3, 4. Di gulong nakasay.
one.
Tapos diyan, basta di dyan nga ito. Tapos ikot-ikot may palado na kasay. Ikot-ikot kayo. Tapos bigla nga kwati na lang buhusan tayo. Kasi di nabuhusan kayo po dito awanin. May pagbakon kita awanin na. Pasok natin. Nabasa gaya.
Tamo mi nga ko ay kami ti roller kami nga kwa. Madingat. Ay na nagbabawi natin Wilma si Candice ko na. Inana lagi yung cellphone min ko bumaba. Nakatayo pa yung tinagpilpilaan mi siyempre na nakadunga tao.
Identity ko, Pwede Ferrari?
One di Ferrari.
Pinas patasan. Napatasan ba rin?
One nga rod. Nagsimbak ko na may straight ka lang ha. Wag mo kaya na nakaganyan ka lang na straight. Wag mong i-ano yung leg mo. Kasi baka mamaya iba yung ano ko na di yung nagkasta. Ay natin siyempre naka-straight taklat ng kasta. Nakas lang nag-ano dito yung leg ko. Tapos kapag kasak di ba bang ngayon napuhusan na kita no? Na may purwak na may gibabaan. Ay, tibuton ko. Wala na Ate Wilma. Nagsabling suna. Madi ko na maulit eh. Sabay ko na kayo experience.
Global Village Summit yung padasan din sa Dubai. Sa Global Village ang hali ko.
Burj Khalifa ka siguro. Wilma J. Kayo. Jumeirah. Payat ko mapanood yung Blue Tower ngayon.
Ano tawa? Ginahato ko lang.
Hindi ko. Burj Khalifa ati pagbagan, ikinti Blue Tower ngayon nga doon kasi mas pinin. Hindi kahit mga papanin. Nung mag-Dubai na ako mapanood.
Mas ato pa pa ng Tito Bay actor nila.
At ado tipo kuan kay Dubai yung dito. Hindi lang kami na nga tada ti ko.
Hindi lang.
Dadayo ti
Area na.
Hangas lang nga dito. Sa bagay ado dito yung nagiyas. Nalaklaka. Dito magpano ata ti pwede hanggang global hanggang di sa kayan ka sa nga po.
Napalkan Jay Garden, ano na Jay Garden?
Yun, miracle.
Napalkan Jay Miracle. Diba, ada yung may ilang tiyan na dali.
Yun. Nakakaliniti.
Kinaman nyo na lang to. Isla, basit ng tamit, gano'n na.
Meron ang tonto na to.
Kita ma. Nanonood yung kumakakanta ng kumakakanta.
So you cannot always predict, but these are some of What about the effect of pregnancy or renal replacement? So anemia is also usually necessitated, and even with infusions, we normally increase the EPO, we increase requirements for dialysis, and when I mentioned that separately later on, and of course the also remaining to be adjusted.
Comment babawa ko sa mo.
So you need to have
October! Ang naman nag-global ang tayo.
Medyo makuha
Kaya
si...
kung makita global, kung na natin yung may sa maling na panggabi.
Sino yung ba Jay mother na ka?
Ang isang kanya ka po, isang naging kami di global.
But actually nowadays, because we become so
Yung kapit ko ba Jay? With juice.
So what we normally do is we increase the frequency of the dialysis more than 20
Yung
hours.
sinapin lang. Nagkaman naman kasi nagkano ka.
And then you need to look at dietary restrictions, especially
Gusto ko, ikaw yung panatinda ng bike. Ito talaga ang buwan naman.
What about pregnancy dialysis?
Juan, matay na talaga.
That's not common. Most patients do not go
Kasing kabel tayo, tanay, kawaban.
Mm.
Pangalan na ako. So, minsan mo, dadala kita. Ako rin yung test like, ano, agwa pa, handa kahit na.
Hindi na kayo ito.
Minta niya na, ano pa kahit maangot na kami tayo. Handa pa, sidan ka.
Handa nga na sana eh. Pwede tibong
Pati aja bagoong nga agay, handa sa kaya, handa kaya. Aja bagoong nga agay, haan. Bagoong dakit mo pa.
Aram-aramang.
Aramang.
Di ana ide. Kay Lordson tayo. Nag-gisanak tikas ka. Bago. Nag-gisa. Nag-gisak namin iging ti ko idi ko. Break up na si ka, bigirwangan. Ayaw ko nung ano yun. I-close mo yung ano ko na. Siyempre alangan garugmok na ako.
Ano di, bagoong.
Wan, nagluto na di kwan sa ide.
Among tipagkamot kami data.
Dinindin.
Kasi lababasik da, ubing da kita. Or kasi lang kanya tayo, ubing dahan da nasanay. Nga siday data. Awan tikas da kanya da talaga.
Awan tikas na bago.
Data lang hanggang Manila lang siguro data. Hindi na nagpuntang Visayas ang mga bogo.
Handa nga mo. Tati kang gamitan da kita para na. Aday katamud ang bugbuong.
So no si Dime kat sila kanya da kita awan parang pangit.
15% of women will develop significant impairment, which may resist up to food, and that's really what you want to know and counsel them before pregnancy. 40% develop continuity was there, but that not necessarily mean that they will have permanently, and 10% might develop new long-term problems.
Hindi yun nabahan.
Hi.
The outcome is optimal if they don't have hypertension, if they don't have
May kumili na luto-luto dahil kakwa, dahil kagabi na, di isungay ti magpalapo.
infection, and those with normal or near normal rate of function.
Manay siguro dati.
But the success is of course better if they're reactive tested.
Kung hindi ko na nga adong at dahil dinig, ikot na ibus na.
Complications are higher if they have function, and those who have
Slice ang tagi.
hypertension or develop preeclampsia, graft rejection,
So,
As we manage these patients, normally we manage them in joint clinics where you have the obstetric physician, obstetrician, a renal physician, as well as the hygienist.
Atay,
Yung na full charge ko rin pa na.
kunin mo na. Sige na.
Kasi dati
yan pa.
Oh.
Yan.
Wag. Oy, ganyan ka na naman dati no, nung
Ha? Sarap.
nag-ano ka. Hoy! Sira ulo to.
Positive yan.
Magpa-positive ka na naman. Inuupuan mo ako. Kaya kailangan.
Grade 1, mahirap. Tatalon na lang din. Ay, magpamatay na daw eh. Parang nasa ano doon.
Sira ulo talaga to.
Manay data. Oh, ano lang ito?
Kaya Ate Ana. Bakit?
Dapat ito sa'yo?
Ha?
Sa'yo?
Kay, ano, kay boss, huwag kang nagbibidyo ako, sira ulo ko. Ito yung, nag-ano na siya. Tsaka yan. Ganda na.
What about neonatal problems? These are widely related to prematurity because a lot of these patients sometimes get delivered early, and that includes priming atrophy, transient leukopenia or thrombocytopenia, sometimes with breast hemophilia. These babies sometimes they have cortical insufficiency because of the use of steroids. Septicemia is not uncommon as well as therapy and vitamin B infection. In conclusion, Renal physiological anatomical adaptation is of great importance for a successful pregnancy outcome. And compromised kidney function or structure may lead to complications including complex renal compromised pregnancy should be managed jointly by an expert in the field of obstetrics, obstetric medicine and nephrology. And you need to